Dr. West, you want to see if you see the page on YouTube?
Yes, sir. Not yet, Ms. Coleman. Do you see it up?
Yes, it's up.
Okay. Well, yeah, we can get started then, and it may come up on my iPad later. Okay, is everybody good to go? Wonderful.
Yes.
President Walters?
Hi, hello everyone.
Hi, we're just making sure
Hello.
everybody's ready.
We're ready. Gary, I love your background. I sent you a little message in chat.
That's wonderful. Okay, so we'll get started. Welcome everyone to the virtual health forum of our 151st Founders Week celebration, addressing minority health challenges in the era of COVID-19. We are here this evening with a special opportunity during our time to celebrate the remarkable strides that Tougaloo has made and will make, but also to ensure that we are putting forth our best efforts in all that we do, including taking care of ourselves, our families and friends. As we all know, we're living in unprecedented times, right? Such civil unrest, politics, a global pandemic, that we need to ensure that we are taking care of ourselves on all fronts, right? So we all know that you can relate health to everything in any possible way, right? Imaginable, everything kind of can be related back to health. But today we're going to focus on some of the particular issues that are specific to African Americans and Black Americans as a primary population that we serve and represent, but acknowledging that many others are also impacted by the major ongoing events in the country right now. So without taking any additional time from our wonderful alums, finally, I'd like to acknowledge President Carmen J. Walters is here with us this evening. Thank you so much for being here.
Thank you for hosting this wonderful event. I'm excited to learn more tonight.
Yes, and Chaplain Maxine Bolden is here.
Yes.
Welcome. We've got Mr. Gary Anderson, our Assistant Director of the Health and Wellness Center. Shalonda Coleman, our Health Educator. And Mr. Derek Caldwell is here behind the scenes assisting us to make sure that everything goes as planned. So I will now just turn it over to Reverend Maxine Bolden to begin with the invocation.
Amen. I appreciate the opportunity and good evening, everyone. As we prepare to pray, I would ask that you would just take a deep breath before we pray so that we can be available to not only each other, but to the Spirit as He moves. Let's pray together. God, we give thanks for who you are, and we thank you for breathing the breath of life into us. We pray that as we come to the end of our day with work yet to be done, that you would refresh and renew us, that we might truly hear and learn, that we might be open to the ways that you are bringing healing to so many who are marginalized. And God, help us to be mindful that we ourselves need healing, that we might be the healers that you have called us to be, even with our woundedness, with our overwhelmed minds and bodies, with all of our resources. We thank you for the promise in your word that we would prosper and be in good health, even as our souls prosper. So prosper us tonight. Thank you for Mata, and Calibri, and all of those who are on the front lines, who are serving and leading, who are understanding and teaching. And we pray that as we go through this evening together, that all of us will be enlarged and open to the healing you have yet to pour into us. Bless us to know and to be known. This is our prayer in Jesus' name. Amen.
Amen. Amen. Thank you so much. I skipped ahead and did the greetings already. I'm sorry.
It's okay.
I'm just moving along. So, Gary, Mr. Anderson is here to offer the occasion.
Thank you, Dr. West. The occasion, the Tougaloo College Owens Health and Wellness Center and the Division of Enrollment and Student Services would like to present this pivotal discussion on health-related issues affecting minorities. Our health forum panelists for today's event will touch on health disparities among African Americans, colon cancer and screening, HIV, AIDS, mental health, and the impact of COVID-19 on the African American community. It is our hope here at Tougaloo College that we all leave here this evening confident in addressing these challenges during this very profound era in world history, and that we continue to be essential workers for students, for colleagues and families, and most importantly, our communities. The occasion.
Good evening, ladies and gentlemen. It's a great pleasure for me to introduce our first speaker tonight, Dr. Mata Munger. Mata is a Tougaloo alum and currently serves as Chief Operating Officer at My Brother's Keeper Incorporated. Dr. Munger is also the founder and CEO of the She Project, a nonprofit mentoring organization. Ladies and gentlemen, please join me in welcoming Dr. Mata Munger.
Thank you so much for that introduction, Ms. Coleman. Thank you for the invitation, Dr. West. And it is indeed my pleasure to be here as a Tougaloo alum. So I bring greetings, of course, to our illustrious president, Dr. Walters. You may not recall, but you and I had the pleasure of talking while I was working on my dissertation. Community colleges, yeah. So
yes. Okay, wonderful.
yes, so it is a pleasure to be here. Greetings to alumni, students, faculty, staff. Thank you all so much for having me today to really talk about this very, very important issue of minority health. There are so many things going on when we start to discuss minorities, in particularly African Americans, and our health outcomes. So I'm going to take a little bit of time today to kind of, it's so many, it's hard to hit it. We could really talk all day long, right? So I'm going to hit some high points. And of course, we could not have a discussion around health right now if we did not talk about COVID-19. So we'll definitely be hitting some points around COVID-19. We can go ahead and bring the screen up and let's dive right into it. And I invite you all, if you have questions, if there's some things that you want to ask, I may not know all the answers. Yes, I'm a Tougaloo grad. We don't know all the answers, but we know how to go get them. So if there's something here that I cannot answer for you, please go ahead and leave those comments in the chat box, and I will do my very best to get that response back to you if I cannot answer you today. So just diving into it, we'll be again addressing minority health challenges in the era of COVID-19. So let's just talk about Mississippi, right? Unfortunately, we don't have the greatest reputation when it comes to health outcomes. Roughly 2.9 million residents in this state. We actually have the highest concentration of African Americans in any one state in the entire United States at almost 38% African American. Pre-COVID, we were at a 20% poverty rate. What's really unfortunate about the state of Mississippi is although less than 40% of our entire population is African American, African Americans make up more than 50% of those actually living in poverty areas, specifically when we start to talk about the Mississippi Delta, right? And I'll hit a little bit on that in just a moment. Overall, when we look at the entire state, and I tell people all the time, if you live in Jackson or if you live on the coast, you think that, oh, well, it may not be so bad, right? As a whole, the state is about 31% poverty rates with African Americans. Now, when we look at the state, 82 counties, 50 of those counties are in what you call persistent poverty. Now, according to the USDA, persistent poverty simply means that those areas, those 50 counties out of the entire state of Mississippi have been in an impoverished state for more than 20 years. Let that set in. More than 20 years, at least 50 of the 82 counties in the state of Mississippi have been at or below the U.S. poverty line. And that, quite frankly, has contributed so much to our consistent and ongoing issues around negative health outcomes, right? We'll talk a little bit about the social determinants of health. But more importantly, when we start to think about where we are as far as schools, we have 7 HBCUs in the state of Mississippi. 7. And we still have these negative health outcomes. We're truly in a chronic state of illness. Now, when you start to talk about worse health outcomes in the United States, we have the 3rd highest percent of adults who are living with diabetes. Now, take that into consideration. That's adults living with diabetes. We have a and it's increasing monthly with the number of young people. And when I'm talking about adolescents who are also being diagnosed with early stage hypertension and diabetes. Now, imagine if you're being diagnosed with type 2 diabetes at 12 years old, that is a battle you will be fighting the rest of your life. If you're being diagnosed with obesity at 12, 13 years old with hypertension, we have 15-year-olds in this state with hypertension, high blood pressure. And what we know is that high blood pressure ultimately links to strokes, right? Heart disease, in our case, and many heart attacks, leading us to having the highest rate of heart disease deaths in the entire country. And the Tougaloo family and alumni are very familiar with that, as we've had a very active role in the Jackson Heart Study. There's a reason the Jackson Heart Study is here in Mississippi. When you start to think about the number of people who are living with heart disease and or dying of heart attacks, we are 10th when it comes to HIV/AIDS rates. And this, for me, because it is, all of these things are preventable, but when you start to think about HIV and the number of people, again, 2.9 million, I mean, the entire state of Mississippi, the population could fit into the city of Los Angeles, not the state of California, the city of Los Angeles, but we rank 10th in HIV/AIDS cases. We don't have a comprehensive sex education program. We don't do well when we start to talk about issues around sexual health, especially talking about those issues when people are young, right? So we have the beautiful internet. So what happens when we want to know something about sexual behaviors? We just go to the internet. Not certain if that information is factual or correct. Many of the headlines dominated in the last few years about where the city of Jackson, with Tougaloo's proximity to Jackson, it's important to talk about that the city of Jackson has consistently ranked in the top 5 of AIDS diagnosis in the country. Now, what does that mean? That means that by the time you find out that you even have HIV, you've already transitioned to an AIDS diagnosis. That is dangerous. So when we start to talk about knowing our numbers, it's important not only to know where we are when it comes to diabetes or where we are when it comes to hypertension, it's important to know about your risk for HIV. And we're not going to hit on the STDs. Like, we are number 1 when it comes to gonorrhea. We are number 2 when it comes to chlamydia. And we rank in the top 10 for syphilis. And it's growing. We're not taking care of our chronic health. We're not taking care of our primary health. And we're not taking care of our sexual health. Right? These are things that we have to take into consideration when we start to talk about health outcomes in the state of Mississippi. Now, when we start to think about leading contributing factors, we're going to start to talk about those social determinants of health. And you hear this a lot. If you're in the field of public health and you know anything about public health, you hear social determinants of health. Well, what are social determinants of health? Well, they are contributing factors that actually determine how healthy you will be. It has a lot to do with where you live, what you eat, the food you have access to, if you have access to medical care. And as we're talking about access to care, oftentimes people hear, well, I have access. There's a doctor right down the street. Access to care and access to quality health care are two very different things, not to be confused. Just because there's a doctor down the street does not mean that that doctor can treat me for the things that the issues that I'm having, right? So we have to be honest about that. But talk about these social determinants of health. When you start to think about where Mississippi is, economic stability, employment, income, expenses, debt, medical bills. Think about where we are. If more than 31% of the people in the state who are African American are in poverty, that means that there's an issue around economic stability. That means that we have issues around maintaining a living wage. Many people talk about, oh, well, they have a job. Yeah, a job is great. And we'll hit on that at the end. But if you don't make a living wage, that does not mean I have access to health care. That does not mean that I can provide myself with the best and safest home, right? It may also mean that I have an extensive amount of debt. And we all know what debt does to us mentally, right? It creates what? Worry. And if you don't know this, let me tell you, if you find yourself constantly in a state of worry or mental anguish, eventually that takes a toll on your physical health. So it increases the likelihood of obesity. It increases the likelihood of heart disease. Let's talk about neighborhood and physical environment, safe areas, parks, playgrounds, walkability. The city of Jackson is struggling right now just to create what they call a walkability within the city. See a lot of construction going on and going around with them trying to create sidewalks. We don't have a walkable city. If I want to go and take a walk in my neighborhood, I'm fighting with the cars just to make sure that I'm safe, right? When we take that into consideration, it makes a difference on if I can get out and exercise. Not everybody can afford a gym membership. So sometimes my health is dependent on my ability to even just walk around my own neighborhood. That's if I'm fortunate enough to have a house. What if I live in an apartment? What if my housing is not a place that is safe for me to be outside in the first place? So all of that has to do whether I'm likely or more likely to be healthy. Now, education, of course, the home of 7 HBCUs, fabulous education opportunities, but way too often, our students, when we start to think about them in the primary education system, they don't always have access to get to us at these fantastic HBCUs. So if there's poor education systems K through 12, then oftentimes our kids are struggling by the time they get to college. And those who are our leadership at Tougaloo, Jackson State, Alcorn, they do the absolute best to bring these students in and get them prepared, but they're not always prepared just to enter college. And I'll tell you, if a student is not prepared, that actually plays on their ability to be confident in being in college in the first place. So the retention as a whole. Studies have shown, research has shown, persons with higher education tend to have better health outcomes. So if you don't have people graduating from high school or finishing, in some cases, junior high school, then what does that say about their likelihood for long-term health? The food. Food is a huge issue here in the state of Mississippi. Many people think, oh, in Mississippi, but you have a problem with obesity. Yeah, we have a problem with obesity, but that's because the access to the foods are not always healthy foods. Think about it, you can go to Wendy's and you can get a 4 for $4, but if you decide to go to McAllister's and get a salad, it costs twice as much, right? So the issues around food insecurity in this state are quite real. And food security, according to the USDA, is the ability to go and get foods that are healthy and nutritional. If you need to think about the city of Jackson, there's a lot of access to fast food restaurants. But what about healthier options? For many of us, for instance, I live in South Jackson. We're in a food desert. I have to drive generally to Clinton, which is 25 minutes away from my house, in order to get access to fresh vegetables and fresh fruits. That's a food desert. It's not about access to food, it's access to quality foods. That, again, increases our rates for hypertension, diabetes. If the only thing I have access to is fast food, likely I have a high salt intake and high fat intake, which eventually is going to take a toll. Community and social context, we think about issues around discrimination with everything going on in the political climate right now. Racism is at the discussion around racism is at an all-time high, right? Since the 60s, I don't believe we've had such discussions like we've had recently around discrimination. It plays a role in a person's health outcomes. And finally, our healthcare system. I think the one thing COVID-19 has definitely displayed nationally, and even in places like Mississippi, is that the shortage and the issues with the healthcare systems are real. And people are not always privy to the quality of care, depending on where you live and or what your race is. It makes a difference. Social determinants of health, they are all leading contributing factors to negative minority health outcomes. Yeah. And as I was saying, we check all the boxes there. Now, again, I said I could not talk about what was going on when we started to talk about minority health issues without starting to have a true conversation around COVID-19. January 21st, the U.S. confirmed our first case in Washington State. By January 24th, we had our second case. And as of October 12th, here is where we are. State of Mississippi, more than 100,000 confirmed cases of COVID, 3,100 deaths, while globally we're at more than 37 million. And mind you, this was the data from last night. I'm almost certain that data is higher as of today, right? Which says that we are in an absolute crisis. When you start to think about, again, the state of Mississippi, consider where we are with minority health, right? So we've talked about number 1 in heart disease, top 5 of diabetes, top 10 of HIV. The city of Jackson is in the top 5, and now we have COVID. Where does that put us for health outcomes? When we start to think about the risk, who's at the highest risk for acquiring COVID? Who have lung conditions, COPD and asthma. Didn't mention that, but we have extremely high cases of asthma in the state of Mississippi. Certain heart conditions, if you have HIV, severe obesity, this is everything I've named. So when you start to think about a state that looks the way Mississippi does, when you start to talk about health outcomes, almost everyone in this state is at risk for acquiring and potentially dying from COVID-19. Something to truly take into consideration when we're talking about our health outcomes in this state. COVID-19 for this state has absolutely been detrimental to the health of many. When you think about it, it was March when we started to shut down, and I put that in quotations because did we ever really have a true shutdown here in this state? An absolute true shutdown. Because of that, by August, Mississippi had the 4th highest COVID-19 infection rate in the nation. Once again, we're in the top 5 of something that is deadly. Our nursing homes, and particularly our schools, our businesses, were all heavily impacted with people living with and being diagnosed with COVID-19. And unfortunately, we saw a number of deaths very early on with COVID-19. Many will say, well, we're back open now, right? So our state reopened officially September 30th, 5 p.m. The state of Mississippi was the first state to lift their mask mandate. We also have gone forward with our state fair. So where does that put us right now? Right now, when you, according to Johns Hopkins, as of October 5th, Mississippi still ranked number 2 with the highest COVID-19 cases of positivity. Now, what does that mean? That means that in most cases, when people go in and are tested for COVID, they're tested because they're already sick. So having a high positivity rate means that there's a bigger likelihood of transmission. And now with the mask mandate being lifted, what do you guys think is going to happen in just a few weeks? Imagine where we're going to be in December. Dr. Dobbs actually mentioned yesterday in his press briefing that we are once again out of ICU beds here in the state of Mississippi. Once again, we are out of ICU beds. Where does that put us in the next few weeks? Data found a researcher, actually one of those researchers came out of the University of Mississippi Medical Center here in Jackson, actually found that as of April 2020, 78% of the data collected by the CDC from health departments was missing information around race and ethnicity. 1 in 5 U.S. counties are disproportionately Black, but they make up 50% of COVID-19 diagnoses and nearly 50% of COVID-19 deaths nationally. I can say the numbers were different in Mississippi. Remember I said earlier, right at we're a little more than 100,000 people in the state living with COVID-19 or having been diagnosed with COVID-19. Of that 100,000 people, more than 40,000 were Black, while an additional 9,500 were other minorities, Hispanic or American Indian. So that means that almost 50,000 of those diagnosed cases of COVID-19 in this state were persons of color, were persons of colors, with the highest group being among African Americans. Think back a little bit and we talked about where we are in this state when we start to talk about health, heart disease, diabetes, HIV, asthma, with more than 40,000 people, African American, being diagnosed. Where does that put us as we continue to go through this pandemic? Where does that put our health outcomes? We start to think about those leading contributors here. A lot of people say, well, why are African Americans? Why are African Americans? Why are Blacks? First, many of us are frontline workers. We didn't have the privilege of saying, I'll work from home. We work at the grocery store. We work at the gas station. We work in fast food. So we didn't have the preview of saying, I'll work from home. Now, I already talked a little bit about access to care, but what I didn't mention was the fact that we're one of the few states that is still not expanded Medicaid. So there's still an issue around access. And God knows we cannot even miss talking about medical mistrust. As we've even talked about a vaccine, how many of you actually said, I will take the vaccine if it became available today? And the matter is, not many of us African Americans, I'm speaking of, not many of us will be willing to even take the vaccine right now. That's dangerous. It's dangerous that we have such a mistrust. It's dangerous that the system right now is creating and really growing this mistrust with how they're handling things around COVID-19. There have also been some misconceptions about perception of risk. Some people believe it's just airborne. I'll get it. It doesn't matter. Or, oh, when my cousin got it, they were fine. They only lost their sense of taste and smell. So I have nothing to worry about. That speaks to our knowledge of the disease. If you have an underlying condition that you don't even know about, that increases the risk that you may likely die of this illness. Not everybody will. Don't want to give that misconception. There are some people, African American and otherwise, who will just lose their sense of taste or smell, who will just have a cough and an aggravating cough, just have a couple of day fever. But there are so many who are laying in hospital beds right now on ventilators, and their families don't know whether they're going to come home tomorrow or not. And it's real life for us, unfortunately, in this era of COVID. Not much different when we start to think about the leading contributing factor, not much different from those same social determinants of health that have increased our risk for heart disease, that have increased our risk for diabetes, that have increased the likelihood that we will acquire HIV. So it's not much different when it comes to COVID. There are a number of things we have to take into consideration. We need to create a solid plan of action around our health outcomes. Now, when we start to think about, again, persistent poverty, how do you even start to change the narrative when you have more than 50 counties in this state that have been in impoverished state for more than 20 years? First thing we got to do is we got to start have a strong community engagement process or education. We got to do better about educating young people, starting young, about their health and health outcomes. How important it is about what they eat when they can make a healthier choice. To help them make those healthier choices, we got to start having more conversations around mental health, that mental health is not being crazy, that being plump or being plus size, it's not always good for your health. Do to improve your health. In a lot of cases, people don't even know where to start with this process. So we got to start with educating. We have to make some serious investments in our public health systems. And here I'm talking to those who are affiliated in higher education. To make serious investments in the public health system starts with providing avenues for students to learn more about public health during their college career. Making health and nutrition an absolute, not just an elective that they take here or there, but literally providing knowledge on this subject throughout their tenure in school. So really investing in our public health systems, absolutely the expansion of Medicaid. That does allow access for people, for many who don't have access right now. And again, I have to say this, access is not just about having a place to go, but it's having a place to go that you can get quality health care and that you can actually afford the services. And finally, we have to make sure that we're addressing the racial and social inequities that exist, not only in the state of Mississippi, but the United States as a whole. It makes a difference having real, honest, true conversations about how race and social status impact one's health outcomes. We have to remember that health, go ahead, you can go to the next one. Health is not just a one-sided view. So so many different things that impact our health outcomes. Right now, I would be remiss as a healthcare professional, as a public health professional, not to say to go out and vote. We have to change the narrative on how we see voting as a whole. Because yes, voting does have an impact on your health outcomes. Because those persons you have in office vote on whether certain bills and laws remain. If we can get more funding here in the state of Mississippi, I didn't put this in here, but if you have not done it, to complete the census, that also matters. Complete the census and encourage those around you to complete the census, because we lose millions of dollars when we don't complete that census. We don't get an accurate count of what's going on here. In the words of our Mississippi mother, all my life, I've been sick and tired, and now I'm tired of being sick and tired. The truth of the matter is, if you've been sick and tired your whole life, you don't even have an idea of what it feels like, of what it's like to even feel better. So many of our Mississippians have been sick their entire life. They've seen themselves, they've been sick, they've seen their mother sick. It becomes a part of their normality. We want to change the narrative by changing the norm. Being sick should not be a norm. We should not be accustomed to the fact that Big Mama had the sugar, so I'm probably gonna get it too. That should be our norm. Healthcare is not a privilege. It is a right. It is a right for every individual in this state as a whole. Consider this. Minimum wage is $7.25 an hour, which is about $15,000 a year. Household of one is at 138% of the U.S. poverty level, making $17,000 a year. Household of four is at 138% of the poverty level at $36,000 a year. The average person, average rent, maybe about $600. That's if they're lucky, $600 a month. That is $7,200 a year. A gallon of gas right now is roughly $2. That's 26. You do $26 times 52 weeks. That's $1,300. That means that if I only make $7.25 an hour, $15,000 a year, if all I do is pay for rent and gas, then I've already spent $8,500 of my annual income. How can we expect health outcomes to change if people have no money for food, no money for healthcare, no money for utilities? They have no money for anything. So we have to take this into consideration when we start to talk about health outcomes. Until we are able to raise people to a living wage, we are not going to see health outcomes change. We will continue to have persistent poverty in this state. I want to take this time to just say thank you all. I hope I didn't run too far over my time. I think I did, but thank you all for this opportunity. I am, again, a Tougaloo alum, class of 1998. If you all want to reach out to me about more information, please do. My contact information is here. But consider the fact the things that I've said today. Everything makes a difference in our health outcomes.
Thank you, Dr. Munger. We really appreciate your time today, this evening. It's a lot of good information. Again, like you said, we could sit here and talk about health disparities and issues all day, right? And how they impact our population specifically. I do have one question though, if you have time. I know you have something going on, so you took the time to stop here with us. I know you've got to hop off the call. But I do have a question about, vulnerable populations. And with you being at My Brother's Keeper, whether or not you have, encountered some of the, sexual minority, LGBTQ, A+ population, and seen some of the issues that are unique to them around COVID, right? So we do know that the data tells us, the research tells us that by and large they are, there's some issues with getting appropriate access to appropriate healthcare, quality healthcare.
Yeah.
Gaps in insurance coverage for themselves and perhaps a partner, that kind of thing. And so I know that, we're talking about health disparities at large here, but just by way of what you do, I wondered if you had some insight around, that particular population, just to provide some additional insight to what's going on for some of our watchers and listeners.
Absolutely. Thank you so much for that question, because that population, and Dr. West mentioned sexual minority. So she's talking about persons who identify as LGBTQI+, lesbian, gay, bisexual, transgender, questioning, or otherwise. Yes, that population, of course, when you start to talk about access, what I didn't mention as a social determinant of health is stigma. So many persons who are LGBTQI experience high levels of stigma in the healthcare system, right? So access in healthcare, even when you start to talk about a COVID test, if I don't feel comfortable walking in your establishment, if I don't feel welcome walking in your establishment to start with, I'm not going to get a COVID test. I'm not going to get an HIV test. I'm not going to even get checked for high blood pressure. We see extremely high rates of high blood pressure, diabetes, and just other primary health issues in persons who identify as LGBTQI+, simply because they don't have a place that they can go to seek health care to even start with. So one of the beauties about My Brother's Keeper and Open Arms as a whole, our clinic, is that we truly have open arms. So we are very welcoming to persons who identify as LGBTQI+ by offering them primary healthcare services. So our flagship offering is what we call our BHU, our Being a Healthier You. And our Being a Healthier You actually allows a person to come in for free, and they can get their blood pressure, their glucose, their diabetes, HIV, as well as STDs, all checked at no cost. So we're normalizing healthcare for even those who identify as a sexual minority. So thank you for bringing that question up. We want everybody else to do it too, though. We want everybody else to normalize healthcare, because Jackson is not the only place that persons who are sexual minority live, work, and play.
Absolutely, absolutely. Thank you so much for that. We really appreciate it. I know you have to go, but thank you so much for representing this evening like a true Tougaloo College alum, fellow alum. I appreciate you. So go ahead and hop off, and we will continue with our forum here with Dr. Calibri Jenkins. Thank you. Have a good evening.
Thank you.
Our last speaker this evening is Dr. Calibri Jenkins. Calibri is also a Tougaloo alum, and currently she serves as the founder and CEO of Release and Restore Coaching and Consulting Firm, as well as being the executive director at Ava Family Services, which is a boutique of mental health service providers in the city of Jackson. Ladies and gentlemen, Dr. Calibri Jenkins.
Thank you so much for having me. I'm grateful for the opportunity to spend a little bit of time here with Tougalooans, helping to educate everyone on what's been going on with COVID and how COVID has specifically touched us when it comes to talking about mental health care in the area.
All right, there we go. I needed to unmute myself. So Dr. Jenkins, thank you so much for agreeing to participate this evening. I know you've been very active with trying to keep the public educated on things regarding COVID and mental health. So I do have a couple of questions. I got some questions prior to today's discussion. So I'll lay some of them out here. How have you seen the African American community affected, overall by the coronavirus pandemic?
Well, I think that COVID brought to light what Black people have known for so very long, like for generations. When America catches a cold, Black people catch the flu. And that's exactly what has happened here with COVID. The problem is that we're at the point where we are engaging in dueling crises. We have the crises of Corona. We have a financial crisis that's going on as a result of Corona being inappropriately handled. And then we have this racial crisis that's going on. And I'm glad that Dr. Munger mentioned social determinants of health, because those things that she talked about, lack of safe and affordable housing, educational and job opportunities that you don't have in a particular, environment or neighborhood, having issues with access to healthcare. Those are things that heighten your anxieties and worries during a time like this. And we have seen that so very often in the Black community. We are, like she said, essential workers. We are the first fired. We are often losing our health care because we are in a situation where we get our health care from our employer. So at this particular time, we've had to deal with a lot. Then you stack on top of that the grief when you've lost a loved one due to coronavirus. And it just adds exponentially. And a lot of times we have been seeing that the mental health of individuals isn't as, it just hasn't been as solid as it has been in the past. Recent studies have found that 40% of people in June said that they had at least one episode of having some mental instability, whether that was depression, anxiety, re-rising of PTSD from issues in the past. So we have seen that there are a lot of things going on with the African American community that's caused us some significant damage.
So
One moment, I was just asking Mr. Caldwell to mute himself. Let me see if I can mute him. There we go. All right. So like you were saying about mental health and issues with African Americans seeking help and things like that, it's sort of a cultural thing, right? We don't go to the doctor. We don't want people messing with our heads and things like that. We don't want to tell people that we're going to see a therapist. I've had my own struggles around, should I go? I want to talk to somebody who looks like me or who can relate. So along those lines, have you seen any changes or altered attitudes regarding mental health since the pandemic started?
Well, let's start off by talking about stigma. That's what you are essentially addressing.
Mm-hmm.
Stigma is when people have negative connotations or negative views of someone simply because they have a mental health disorder. The flip side of that coin is the way we view ourselves when we have mental health disorders, whether that be depression or anxiety, or like you said, just thinking about whether or not I should go see someone. If that thought pops into your head, yes, you should go. But because there's such stigma associated with, seeking help, we don't do that. The whole scenario of the strong Black woman is something that needs to die immediately. We are not super women. We should not be encouraged to take on everything and hold everything and everybody down. That's not something that we should be doing. Mental health issues, that's not saying that you are not connected to God or there's some sort of weakness there. It is just like if you had hypertension or if you had cancer. It is the body's way of saying something here is not right. We need to address these issues. So I think the first thing is getting over the stigma. I think that the millennial generation has done an excellent job of kind of moving forward past that. They talk about seeing therapists. They talk about, well, I suffer from anxiety or I suffer from depression, when we would never talk about those kinds of things. So I do think that we are moving forward somewhat, because you do have the younger generation who is just putting things on the table. Now, the other part of it is that, over the past 7 or 8 months, we've seen a rise in people having issues with their mental health. Mostly people who had previous mental health conditions before, but again, you're having people who are knocked on their butts for the first time, people who are having to go to, food banks, people who have worked all their lives and now found themselves without a job. So those are brand new stressors. Coping skills that they've had in place before just aren't working the same. So we're getting new people, who are coming down with some issues that need a little bit of help. But again, I personally believe that everybody needs a therapist. Just because you see a therapist doesn't mean that there is something wrong. You need someone objective to be able to talk to about the things that are going on. Someone who isn't afraid to hurt your feelings and say, sis, that's not a good idea. That didn't work last time. Why are you doing it again? So we have to normalize that first of all, we don't have all the answers, and our friends are our friends. So they're not going to hold us accountable the way they should when it hurts, the way a therapist would. So I think that everybody should have a therapist. Everybody should be talking to a coach to help them, just get through those rough patches in life. And if we were able to do that, I think that we would be in a much better position when it comes to, truly dealing with our mental health.
Right, that's an excellent point, and I wanted to make mention of, a lot of times, you may go to your friends and say, ask for their opinions and help, and they may not always give you the best advice. But then, what I've learned with my friends is I ask, do you have the mental space right now to listen to me? Because we all have our own issues and we're going through different things, and sometimes they just don't have the mental space to hear me, right? And then I have the friends that say, well, let's just pray about it.
Mm-hmm.
Saying that, yes, I can offer a prayer and chaplain boat, and you can chime in. That does help, but there's also different parts that need to be helped in different ways, and so we have to, explore all of the options beyond that. But I wanted to ask you if you all, have seen in that field an increase in new folks coming in, for treatment or to talk to somebody. And I think, my best guess would be people who have already been diagnosed with a particular mental illness. Perhaps this is exacerbating the issues that they already have.
Most definitely. Let me go back to what you said earlier. I think all of those things have their place. Talking to your friends about what's going on in life, praying about your particular situation, and seeing a therapist. None of those things have to be exclusive, and none of them have to say, okay, it negates the others. Friends are important. We need to be able to vent sometime, but venting is not therapy. Venting doesn't get you to a new place. You need to pray about it, because some things are just out of your control, and you need to be able to say, let me lay these things at the foot of the cross and walk away, and have some faith that there are some things that I just cannot work out. But then there are the things that you do have control over. There are the things that you can do. If I know that I love chocolate ice cream, and if I buy a pint of Haagen-Dazs chocolate chip, I'm going to eat it all. I need to not buy that. My friend is going to say, Calibra, girl, enjoy yourself. You worked hard. You need it. My therapist is going to say, did you have to throw up a size in your pants? So there's room for everything to happen without it being exclusive or, negating the other thing. Now, I think that the population that is most vulnerable to the deleterious effects of what's going on with COVID is that population that already had some type of mental illness going, who was already, struggling with whether or not, how stable they were. Those are the individuals that are at most risk. But again, there are people who are experiencing life in ways they never thought that they would ever have to experience life. And that type of stress, that type of upheaval, is people, you create coping skills from life experiences. And if this is something that you were never food insecure, you were never, on the verge of losing your home, if you have never had an issue with, I have a chronic health condition and now I lost my job, but I don't have health insurance. If those are not things that you have had to deal with, being thrust into them suddenly and often all at one time creates a problem. So we've definitely been getting seeing new people. But again, like you said, that population that was already at risk is the most vulnerable at this time.
Right. And you brought up sort of self-medicating or in a way with ice cream.
Mm-hmm.
Right. So we all have vices and we use those sometimes to make us feel better temporarily.
Mm-hmm.
And so, mental health is something that we're aware is an issue, among our community, and we are working diligently, every day to ensure that we're addressing it and making sure that our students and our employees can access care, mental health services this fall, but more so in the spring when we are in full swing in the
Mm-hmm.
semester, and we want to make sure that people can do it in the safest way. So, aside from Haagen-Dazs ice cream, and mine would be buying things I don't need on Instagram.
Amazon is a problem.
Because, that's a new way of marketing now with this social media, and they make things look really nice and you don't need it. But on a serious side, our clinical staff here addresses mental health issues and substance abuse and use and things like that. So my question to you is, and as an aside, I know that we've been offering our fitness classes virtually, right?
Mm-hmm.
And so
Mm-hmm.
I know from experience that sometimes physical fitness and things like that help individuals in recovery and assist them through their process from day to day. And I know that there's programs right now around that so that they don't relapse. But I'm wondering whether or not, we haven't heard a whole lot about it, but an increase in substance abuse, overdosing, and things like that, or anything else that you think that you have seen or witnessed that has worsened since the beginning of the pandemic.
Substance use and substance abuse is definitely on the rise, whether that's alcohol, using marijuana to cope, or other illicit drugs like cocaine, heroin, and other opioids. Those are things that are definitely benzos. Those are things that are definitely on the rise because, again, people need to cope. Some people cope with ice cream or shopping, and other people have maladaptive skills, coping skills of, substances. So those things have definitely been on the rise. Something that I want to talk about particularly that I don't think we talk enough about in the Black community is the opioid crisis. And I think we don't talk about it because it was initially a white people's issue. And that comes from the fact that the medical community had and continues to have biases against Black people. They did not believe our rating of our pain. We were looked at as drug seekers. So we were less likely to get opioids. But what has happened is that we have caught up with synthetic opioids. So we were insulated at the beginning of the opioid epidemic because of racism, plain and simple. But we have caught up to and are just as involved in the opioid crisis at this point through street drugs that looks like fentanyl, that looks like tramadol that's being sold or manufactured, in a home laboratory, or that looks like heroin. And heroin is often used because it's cheaper than, buying Roxy or Oxy off the street. So our rates of opioid use is just as high as white people. And if you look at the ethnic minorities, we are the highest users of opioids. Our death rate is right there from overdosing is right there where our white counterparts are. They're probably about 15 people per 100,000, and we're about 13 people per 100,000. So I want us to be aware that the opioid crisis is real. And because of the pandemic, more people are using drugs, more people are being introduced to drugs that they never would have been using before because of the circumstances of life. So I don't want us to overlook something that has typically been described as a white person's issue, especially with the way it's been treated with treatment versus criminality. We are still involved in that. And the unfortunate thing is we still get the criminality part of the opioid crisis and aren't offered the treatment aspect as our white counterparts are. So we want to keep that in mind when we talk about substance use.
Thank you so much. I wanted to share a quick personal story that my colleagues are aware of, but Calibri was almost my line sister in Delta, fall of '99. But my dad died of an opioid overdose in '99 when I was here at Tougaloo. He was a medical professional, a dentist, and dealing with a lot of issues, and overdosed on heroin. And so it didn't keep me from Delta, of course. I played the following year, of course. Stay the course, Dana.
That's right, stay the course.
That's right. But it's just an example of how someone, we think that, opioid impacts rural white men, right? But it also impacts, the wealthy, the professionals, and even the medical professionals, and people who are dealing with different levels of stress, different levels, different devils, and things like that. So, he was at the top of his game, but he was also sort of a career drug user. Right. And so you think that going through NA over the years, that you can kind of handle the same level of heroin that you did in your 20s, in your 40s. And he couldn't do that. And so that took him out, and also his brother 2 days before. So, September 11th and September 13th of every year here at Tougaloo, it kind of brings back memories. So that's just my personal story around it. It's definitely a difficult thing to remember, but something that is near and dear to my heart. And I certainly understand, how mental health impacts all of us, from students, to faculty, to staff, community members, essential workers, healthcare professionals, and the like. So moving on from that to something else is, with the state opening up, long before the data supported doing so, right?
Long before.
They wanted to do it because people were isolated, and we were at the time. We wanted to get out of the house. We were missing our friends. Some of us were missing our colleagues and coming to work and things like that. And so they opened up because they wanted to prevent, people harming themselves, potential suicides, and all the things that come along with isolation and being alone and idle minds. So I'm just wondering, in addition to, substance abuse, what about, the suicide rates in the state or in the nation? Have you seen an influx of that among our community? And then, just as a whole?
So pre-COVID, so I deal a lot with children. That's my spot. So pre-COVID, there was a fourfold increase of suicidality in young children ages 5 to 12, specifically in young Black children ages 5 to 12. So suicide had been something that, even when I was in medical school in the early 2000s, that was something that older white men did, and white boys. That was not an activity that Black people participated in. But by 2017, the statistics showed that the rates of suicidality in our population was increasing dramatically. So we had a problem before COVID, but I have seen in the last 10 days, 2 young people commit suicide in just the past 10 days. So it is a problem. That study that I talked about that, surveyed about 5,500 people back in June of this year, there were 10% voiced the desire to harm themselves within the last 30 days. So that's a very large number, and Black people are not insulated. We are just as active in the act of doing self-harm, and that self-harm often leads to our death, but it is something that is on the rise in our community. I always tell people, when somebody talks about suicide, take them seriously. I don't care if they talked about it last week and the week before. It only takes one time to kill yourself. So if there is someone who you are in the presence of who talks about suicide, or who has started to behave differently, is giving things away, is talking in terms of, where it can be construed as they're trying to tell me goodbye, or they're trying to prepare me for something big that's about to come. Pay attention to those things, because our community, our ethnicity has been engaging in these activities more and more. And because that's not something that we typically do, we don't have the verbiage to talk about it. We don't have our spidey senses up to really recognize it. So I want us to know that suicide is real. It's happening with our young people. It is something that has been on an uptick because of the coronavirus, and that we should really be paying attention and listening. Check on your strong friends. Your strong friends are the ones who you need to check on, because again, they have not been in a position to have to be vulnerable, and they feel like that they are oftentimes a support for other people. So reach out to your strong friends. Let your strong friends know that, hey, I'm here for you. If you need something, you don't have to be strong. You can come and sit on my, well, not during COVID, but we can Zoom, and we can cry together over Zoom. And I can help you work these things out. So we have to just be in tune with one another. I think that that's one of the blessings that have come with COVID, is that we've been able to slow down a little bit, been able to pay a little bit more attention to people, and hear what people are really saying to us, because we're not so on the go. So let's just really pay attention and be there. When you hear somebody who may need help, reach out. It only takes one time to reach out and listen. You may save somebody's life that day.
Absolutely, absolutely. In addition to the pandemic, there's so much going on for us to deal with, right? And like you said, we should check on our strong friends. We should all check on each other and ask, how are you doing today?
Yes.
Just a simple, how are you doing? I've learned with, at work, when I call people, I start talking about what I need. You go right into I need, and I'm starting to say, hold on, I'm sorry. Let me start over. How are you doing?
Yeah.
Are you okay? I lead with that, because that's really important now. Earlier you mentioned racism and social unrest as part of this whole, overwhelming crises that we're all dealing with. How have you seen it sort of manifested in our community specifically?
So like Dr. Munger said, we've been going through racial trauma since we stepped foot on this land. We have been the recipients of unthinkable injustices simply because of our race. But what I have seen recently is racial trauma being more and more prevalent. Before the advent of social media, you heard about things happening, you read about things that happened in the past, and you could kind of handle that. But social media has put it on display for everybody. You see it time and time and time again. I call it murder porn, where we see these Black men and women being murdered on social media, and it's played over and over as if it's not a big deal. But what that does is it often ingrains in us a sense of unworthiness, that because it becomes so, it normalizes it. You see it so often, it normalizes it. So I had to stop looking at these things. So what racial trauma is, it's whether you are experiencing discrimination personally or vicariously through social media or the like, it is the increased heightened awareness that something bad is going to happen to you. You're always on edge. You're waiting for it to happen. And then it's often compounded because you are often being gaslit by other people saying, oh, that's not the case. You know, that person getting the job over you when you have been here in this position for 5 years and you've got the education, they walked through the door 2 months ago without the education and they got the promotion. Oh, that's not racism. Those constant kind of microaggressions and macroaggressions that happen lead to you just being fed up. So I think that George Floyd's murder, and I'm not going to call it a killing because he was murdered by Officer Chauvin, his murder brought to light for other people, not for us, because we knew it was there. For other people, it brought to light for them that, oh my God, this really is happening. So that bit of racism, that bit of putting it on display for the world has kind of given our cause validation. But the other side of that is you get this momentum, you get this movement, and then nothing happens. There are all of these protests, and then there's no systemic change. There's no legislation. There's no, changing in how we are treated or looked upon. So even though we made 2 steps forward, we've still got all of these steps to go. So the pandemic has only reinforced what we already knew. Things will get a little bit of light. It'll go on, life will go on, and we'll be still in the same situation. It's the same thing with COVID. We talked about, why are Black and brown people more at risk of death? Oh, it's the social determinants of health. We talked about that for 2-4 weeks, and then it went by the wayside. No legislation, no real change. Nothing has happened. Our attention spans are just too short in this country to make long-lasting change. Either that or our pockets aren't deep enough to influence Congress. I haven't figured out which one it is yet, but we've just got a long way to go when it comes to racism and really solving the ills of the country.
So with all that we've discussed this evening, what say you around how the Tougaloo College community can cope? What are your recommendations for how we manage and cope with what's going on right now, and with all that we've been told to expect in the fall, or the winter, around how much worse things are going to get with COVID? I'm willing to bet that we will still be dealing with the same issues around racism. Health disparities will still be here in 2 or 3 months. So things conceivably are going to get worse. So I'd like to pose that question really to you around your recommendations for coping and managing during this hard time. But also I'd ask for some encouraging words from Chaplain Bolden. And then finally, a word from the lovely President Walters before we go, because I think, this is an opportunity to hear, from our clinical psychiatrist, from our chaplain, and then from our leader, to everybody on the call or who is able to watch later, around how you all see us moving forward, and just some words of encouragement. So Dr. Jenkins.
I think the first thing that you have to do is mask up, social distance when possible, and wash your hands. That's by far the first thing that you have to do. The other thing is take control of the things that you can control. Being social is very important. Having social connections are very important. When your mental health is not where it is, nothing else about life is right. So I have told people that you have to get creative. If it takes you saying, I'm going to get together with my girlfriends, we're tired of Zoom. Okay, so what you do is everybody gets in their car, goes to the old parking lot, of a business that's no longer opened, or, use a parking lot and pull your cars in, and everybody sits on their car and gets to talk to each other. You're socially distanced, you've got your mask on, and you can see your people and have something that resembles what life used to be like. I would suggest making sure that you are taking care of yourself. Self-care is very important. Self-care is different from self-soothing. Self-soothing is, I've had a long day at work. My coworkers got on my nerves. I'm coming home and I'm going to veg out in front of the TV, or I'm going to eat a pint of Haagen-Dazs ice cream. That's self-soothing. It feels good in the moment. It picked up your spirit. You feel better. Self-care is carving out the time to do what you need to do. Meal planning, figuring out what do I need to eat, going back to Dr. Munger and what she said, figuring out how to eat better, figuring out how do I incorporate exercise into my daily routine, or at least 3 or 4 times a week, doing those kinds of things, having family self-care. We're going to have movie night, or we're going to go on a hike this particular day, and scheduling those things into your life so that you can create some new normals and memories for your young people, memories for yourself, things that help build yourself and your family in the long run. So create those healthy ways of self-care. Be creative when it comes to engaging with those people who are near and dear to you, and then making sure that you're masked up, your hands are clean, and that you're social distancing when possible.
Thank you. Chaplain Bolden.
Amen, and wonderful. I want to affirm what Dr. Munger and Dr. Jenkins said, especially in the areas of, we hear people and we say, we'll pray about it. Well, I'm a different kind of pastor because of my pastoral care background and my chaplain's background and my clinical background as a chaplain. And so I do say pray about it. And I say pray that you're led to the right therapist. Find someone you can talk to who will, as Dr. Jenkins said, hold you accountable, who will hold your feet to the fire for those things you can change. As it relates to our mental health, I think spiritual and mental, emotional, all of those are related. And so, you have to be intentional to build the relationships you do have with people who not only see you, but help you to see someone who can help you with those things you're struggling with. What can you do on a personal level besides prayer and reading your Bible? You can do some of those things that Dr. Jenkins just lifted, but I'll add a couple more. Get your sleep, get your rest. You may not be okay with 4 hours of sleep. You may not need 8, but learn what works for you, where you can really wake up rested, where you can feel renewed. Stick to a routine. Routine helps because it helps people to see you, and it helps people to gauge where you are so that you're not missing, on a regular basis. Do check in. I love that idea of drive-by. I have a really good friend who happens to be a soror, and she does drive-bys, and she'll call and say, I'm on my way to your house, stay on the porch. I'm going to stay in my car. She'll stay for 10 minutes, talk to each other, look at each other, see each other, know that it's okay. Besides a regular bedtime, besides seeing people and laying eyes on each other, make sure you are taking care of your basic needs. I have a friend who works there. We're in the same area on campus. We'll call and say, hey, have you gone to lunch? Did you eat today? Because you get busy, you get overwhelmed, you forget to eat. And you forget to eat healthy, as you pointed out, Dr. West and Dr. Munger mentioned, making sure you're eating a quality meal. Do some mental health fun. And I say mental health fun because sometimes you can work too much. Allow yourself to have fun and to laugh. Take some time out of your day. In the Bible, we call it Sabbath. But I say you should have some crazy space. And crazy space is not when you go off on people, but it's space where you let yourself be your real self, where you laugh, you cry, you play games, you watch too much TV for an hour or 2 hours, but you let yourself have some space, where you don't hold yourself so tight and to take yourself so seriously. And then finally, one thing that I've learned, and I tell everyone, turn off the news. Stop watching so much news. Don't watch CNN every time you turn on the TV. Find something silly, funny, stupid to watch on TV where your brain can detach and relax a little bit, because it's really important. And then, do pay attention to those spaces, though, where you realize you're not yourself, and reach out to people and say, I need help and I am praying. What else can I do? Because prayer sometimes becomes an excuse not to do what you need to do.
Very good. Thank you. President Walters.
Well, first of all, I want to say to you, thank you for all that you are doing at Tougaloo. This was a wonderful, wonderful event. I've learned so much tonight. I already emailed Dr. Munger for her presentation. I want to share it with my family. I think it's so much information in there. And Dr. Jenkins, you and I were on a call before, so I always look forward to hearing from you. And the chaplain, you guys are just wrapping it all up. And, you know, there are so many things we talked about. One of the things I do want to say to whoever is listening, let us not walk away hopeless and feeling that there are no solutions to all of these challenges that we are facing, whether they be health disparities, whether there is social justice challenges we're facing, mental health challenges. Someone is helping and working on these ills, and we have to know that and we have to support that. And so how do we do that? Well, the first thing we have to do, of course, is vote. And I'm ecstatic. I'm watching social media all day to see that the polls, the lines are wrapped around the polls, and that is a very good sign. And so that's the first thing we have to do, is get the right folks on the bus. Then we can start seeing if we can get some laws changed and trying to help our families at that level, right? At that governmental level. And we can do that if we put our feet to the fire and get out and vote and get others to vote and give folks rides. You know, there's this little story about the starfish, and the gentleman saw the guy dancing every morning, dancing on the beach every morning, and he didn't understand what he was doing. And so he got out there early one morning to say, let me see what this dancer is doing. Well, he realized the gentleman was picking up starfish and throwing them back into the water. And he asked him, how are you making a difference? Look at all the starfish on the beach. How are you going to make a difference by doing that? You can't possibly help. And he picked up a starfish and he threw it in the water. And he said, I just helped that one. So if we start where we are, if we use what we have, if we help who's in our presence, we are making a difference. And the people on this call do that every day. Dr. West, you do that every day when you educate our students thoroughly about what they should and should not do, when you educate the constituents, when you work with all of the people in the Delta to help them with these health initiatives. You do that every day. Dr. Jenkins, you do it every day when you're using your wonderful counseling skills to help folks understand the real self, because we don't know our real self. Sometimes we need somebody to help us look into ourselves. And Chaplain, you help every day when you do those prayers and you encourage us through the word on social media, and you do those little sermonettes that you share with us before you pray. Even when you encourage us to engage in the alma mater, it gets us working together and feeling a part of a community. So all of you are making a great, great difference. So don't dare walk away from this panel feeling like the road is very long and it's very arduous, and that our backs are bent over, because we are training students here at Tougaloo and other HBCUs are training students to come and pick up the mantle on these very same issues, to beat the drums louder, to make change, to be the governors and the lawyers and the doctors. And so I see a very positive future, that as we continue to educate, we're going to have more Dr. Jenkins and more Ms. Coleman's and more Mr. Anderson's, and we're going to have more and more. That's why this HBCU life matters. It's more than just I'm getting a degree, but it's I'm picking up the mantle. I'm doing what I know is right to do to help change the next generation. And so I'm excited about where we're going. I know where we are right now, but I'm excited about where we're going because you are sounding the alarm. My nephew committed suicide about a month ago, 27 years old. and we had no idea that he was that depressed. I understand that. My daughter attempted suicide many years ago. I had no idea. It woke me, right? It shook me. I began to really see life differently. She's a very strong person today, very much engaged with helping others and doing what she can to make others stronger. We go through those experiences and then we can see, how is this affecting me so that I can help teach someone else. And, Dr. West, you have a phenomenal story. I never knew your story, but now I understand your drive. And so it was important for you to share that tonight, for me to hear that, because I was questioning, this girl never stops. You have a project continuously, and it's never about you. It's always about someone else in the community. So I get it. I understand that. So thank you for sharing your story and being open to our audience and to our students, because they have to know that we are here for them and we're going to help them through these rough times. COVID is not going to be with us always. We may have something, but it won't be COVID always. We'll get through this. And so I just want to thank you guys, because this was absolutely fabulous. I think it was a priceless conversation. You couldn't have charged for this because it was too valuable. I think it was straight from the heart, and I think it's really, really impactful. So thank you so much to all of you.
Thank you for that, President Walters. I'd also just like to thank Dr. Munger for joining us. Dr. Jenkins, thank you so much. Chaplain Bolden, President Walters. I'd really like to thank my team. Shalonda Coleman and Gary Anderson. I'm going on record in perpetuity, probably on YouTube, saying that I need my team. You all, I could not do it without you. There's no way that we could do the things that we do, specifically without Gary and without Shalonda. There's just no way. We make a perfect team. And Dr. Howard and Carol Mack in the Delta and Adriana Ellis. We've got some incredible team members there, DeJuan Watts and Justin Dishman. I mean, I could go on and on about everybody there, but we have some dedicated people who love what they do, who are really here to serve the community, and we're just really happy to do it. Like you say, won't he do what you say, doolallooya? And
put some hallelujah with your doolallooya.
Yeah, so we got the doolallooya. We want to do it, and we do it, and that's how we get things done. So thank you to everybody who took the time to get on the Zoom today, and to everybody who watches it later. If you have any questions about the information that Dr. Munger or Dr. Jenkins presented today, you can certainly reach out to us at the Health and Wellness Center, 601-977-7797, or you can find our emails on the Tougaloo College webpage, and any information that's going to go out around COVID and the community is impending and will be on our Tougaloo College Health and Wellness Center page. So I say to you, thank you so much. Everybody go forward in peace and love, and especially peace of mind. So thank you all, and have a good evening. Bye-bye.
Thank you. Bye-bye.